Hey YouTube fans, this is BGA. I wanted to talk to you about something that's been on my mind today, and been watching a lot of videos on the subject, particularly videos by Dr. Mark Viner, who has been a huge inspiration for me in my career. He's a great psychiatrist based out of Arizona, deals with a wide variety of patients, and 99.9% of things him and I see eye to eye on. And yeah, I guess we're both a little eccentric in our own ways. But the one thing that I just watched a video of his on some of the benzodiazepines, who brand name wise, I'll just stick there for right now. Xanax, Valium, Librium, Ativan, things like that. And most of the videos, if you look on YouTube and just type in Xanax, most of the videos are going to be withdrawal stories, kind of like really horror stories. But if upon first glance, if you look at them, you're going to say that this is a terrible, terrible drug. It should be pulled off the market. And the same thing basically happened to Valium. It was the most commonly prescribed drug at one time in the U.S. in circa the 1970s. And I really feel like this family of drugs have been demonized. Now, I am not a psychiatrist. I am not an MD. I'm a psychologist. I'm not a psychiatrist, not an MD. I'm a psychologist in training. However, I do plan on getting my master's in psychopharmacology. I have so that hopefully I'll be able to prescribe as well as do therapy, where psychiatrists can only prescribe and not do talk therapies. They used to, but insurance companies have pretty much killed that. So yeah, so that's just a little bit about the information I know. I've done research in neurology departments, in psychiatry departments, drug trials, neurological studies. So anyway, I'm not claiming to be an expert, but I have a basic knowledge that I think I can speak on the topic. So Xanax in pop culture, songs about Xanax bars, the common form of the 2 milligram dose. The movie Sex and the City, and sort of different pop culture icons talk about Xanax today, how people did about Valium in the 70s, 80s. It's not uncommon for someone to go to their general practitioner and get a prescription for Xanax for when they fly, or a prescription for Ambien, which is a benzodiazepine-like drug. What you really have to know is that these drugs aren't nearly as dangerous and as evil as many people would lead you to believe, if they are used properly, and if they are used in the manner in which they're designed. Xanax, so this family of drugs is called benzodiazepines. So they all function to basically increase GABA levels, which is a calming chemical just to keep things simple, in our brain, a inhibitory neurotransmitter. So that's what they all do. However, how they go about that, how long it takes them to start doing that, how long, when they stop doing that, how long it takes for the drug to be metabolized, something called a half-life, which is how long it takes for half of the drug to be eliminated from your system, are different for all of them. So the kind of simple analogy I like to use is if you think about a group of people, let's say, who are all have a common goal of driving from one state to another, picking up a package and driving back. So you've got one guy who, or a girl, who's in a Ferrari and is speeding and just goes there, gets the package, comes right back, and that's it. Her job's done. And you have an older gentleman in a Lincoln Town Car, and he makes a couple of stops along the way. He takes his good old time, gets the package, does a little sightseeing, stops and gets something to eat, and takes him a little bit longer, but he still comes back with the package. So that's more like a Klonopin. And then you've got let's say like Halcyon, the drug that was called it developed a nickname of the hip breaker. It had such a rapid onset. It was prescribed to elderly people a lot years ago for insomnia. And it was a very fast-acting, very strong drug. A lot of produced kind of like an amnesia effect. Well, it was nicknamed the hip breaker because these elderly people would take it, lay down in bed, have to use the restroom shortly after, get out of bed, and forget that they had taken this very strong drug, and just fall over and break their hip. So Halcyon is not too widely prescribed. It still is, but not too widely, and it's usually older physicians that prescribe it. Its number one use nowadays is in sedation dentistry. So when they say on the advertisements for sedation dentistry, just a small pill and you won't even remember the procedure, etc., it's Halcyon. So plain and simple, it's a member of the benzodiazepine family. So each one of these drugs has a purpose, and unfortunately, not a lot of general care physicians, especially nowadays, boutique physicians, just with what insurance companies have forced physicians to do. They're very quick to prescribe whatever their patients come in asking for. So somebody sees on TV or talks to their friend, says, "Oh, I take a Xanax every time I fly, and I go right to sleep, and I wake up and I'm there." I'm not saying there's anything wrong with that. If you can, are responsible enough that you only use it once in a while, when let's say you fly 3 times a year, you have a slight fear of flying, but that shouldn't be the first go-to option. A lot of us have taken Benadryl. Well, guess what? There's a drug called hydroxyzine, which is a prescription antihistamine, very similar, that is extremely sedating, not habit-forming, you don't develop a tolerance, and that's a great first line, and it's very safe. So you've got that. You've got before drugs like Prozac, which are in a family of medications called SSRIs, which stands for selective serotonin reuptake inhibitors. I'm not going to go too far into that. But before those, there were tricyclic antidepressants, and one of them is marketed under the trade name Silenor, and if you have insurance, it's a very low dose. But basically, Silenor took advantage of the sedative, hypnotic, it helps you fall asleep. And that was one of the side effects of doxepin. So Silenor, sort of the commercial drug for that. So if you have insurance and you want a really low dose, I believe it goes down to 2 milligram dosages. If you get the generic doxepin, it's a 10 milligram. That's another option. So may or may not help you a little bit to supplement. If you're taking like a Prozac in the morning and a doxepin at night, may help with the depression and anxiety a little bit, but it's at least enough to help you fall asleep. You've got over-the-counter melatonin, which works wonders for people. So there's lots of options to help you fall asleep without jumping to a benzodiazepine. So my personal opinion on benzodiazepines are not that there are these evil, this evil family of medications that needs to be outlawed, eliminated. That would be very unfortunate. But they should not be the go-to drugs. They should not be given by general care practitioners, in my opinion. They should be given by psychiatrists or prescribing psychologists who are carefully monitoring their patients, making sure that they're not prescribing, hundreds of them at a time, etc. Now, one of the advantages of the benzodiazepines, why they came about in the first place, was before benzodiazepines, barbiturates were used for similar purposes, and barbiturates have all but been completely replaced by them. I'm not saying they don't have their uses, especially with certain neurological disorders, but barbiturates were potentially fatal in overdose. The benzodiazepines by themselves are not fatal in overdose. If you mix a benzodiazepine with another depressant, so alcohol, opiates, painkillers, etc., the synergistic effect can make it stronger than these drugs would be individual, leading to respiratory depression and possibly even death. If you suffer from sleep apnea, completely increased risk of that. So at nighttime, don't have a nightcap shot with your nightly Klonopin. Not a good idea. There are other options. Make sure you explore those with your physician first. And if your physician jumps to a benzodiazepine, it's perfectly acceptable to ask why, and mention some of the medications, the hydroxyzine, even just an over-the-counter Benadryl, added benefit of being an antihistamine, so it helps with potential allergies and helps you sleep. Ambien, a benzodiazepine-like drug, great for extremely short-term use. Problem with Ambien is it has I believe the half-life is even shorter than Xanax. I'm not 100% sure on that, but it's very short. So the idea behind it is it helps you fall asleep and then wears off quickly. Theoretically, you stay asleep and wake up and it's totally out of your system, so you wake up refreshed. However, what we found is that a lot of patients who take an Ambien wake up in the middle of the night and can't fall back to sleep. So they'll either take another one or take some alcohol or something else. So I'm not a huge fan of Ambien. But like I said, there's every drug has a purpose, and every drug reacts differently to every person. We're all different, so we can't just say, Xanax is bad, Valium's bad. It's a lot of it's trial and error, and I think Dr. Viner, Dr. Mark Viner, who I will give a plug for on YouTube, he has his channel is Doctor of Minds MD. He's a great psychologist. His videos are fun and educational. He talks about a lot of options, but he's very anti-benzodiazepines, if you ask me. And that's kind of the only thing that him and I do not see really eye to eye with. I'd really love to have a conversation with him either in person or over the phone, etc., about that, and learn more about why he feels that way. But if you look at why people who abuse drugs in general, be it a benzodiazepine, be it an opiate, they're trying to self-medicate most often for something. It's not. I unfortunately have a very good friend who recently admitted to me that she was snorting heroin, and this was quite upsetting. But speaking with her and asking her why, I know that she, for years, has suffered from severe physical pain, has not always had great health insurance, came from a religious extremist family, kind of, if Jesus wants you to be sick, you'll be sick. And she gained a lot of weight. Now, she's not lazy by any means. This is someone who was a honor student all throughout college, was a stage manager for 4 shows while taking a full course load and working. I mean, stayed up all night. But her physical problems, mainly severe back pain and ankle pain, led to obesity, a sedentary lifestyle, and really she can't do a lot of jobs that she would love to because of how much pain she's in. And when she first told me about the heroin, it wasn't a call like, wow, I'm so high, I feel like I can fly or something. No, it was more of a, for the first time in my life, I'm not in pain and I can actually work. So I take that into things like that into consideration when I work with patients. Just because somebody is an addict doesn't, I don't immediately put that label of an addictive personality that no matter what I give them, they're going to abuse. A lot of doctors do that, and I really don't agree with that. So I just wanted to put something out there, because it seems like the majority of the videos that you see on YouTube are demonizing all of the benzodiazepines, and it's really not fair. If you look at the cases of people who have like severe complaints about their usage, it's mostly long-term, which a lot of them are not indicated for long-term use, and they say sometimes that the anxiety post stopping or tapering off of the benzodiazepines actually caused more anxiety than beforehand. Well, you've got to really think about the validity of that, because they've been on a strong anxiolytic for quite some time, feeling very little anxiety, if any at all. They suddenly discontinue that, and it's been years. it may just be the original anxiety returning. We don't know. So that's got to be taken into consideration. There are a lot of psychiatrists who will recommend things like a low-dose atypical antipsychotic to help with insomnia, anxiety, etc. Weight gain, tardive dyskinesia. You ever seen videos of psychiatric inpatients walking around going, having like involuntary mouth movements, or walking a little strange, Parkinson's-like symptoms? I don't know about you, but personally, I'll take my I'll take the side effects of a benzodiazepine over that any day. Like I said, weight gain, diabetes. So it shouldn't be a go-to, but let's not demonize them as much, because we're really, if we do, we're going to lose a great tool that we have in our toolbox to treat patients. Xanax is great for, now all anxiety, just because someone has an anxiety disorder, there's tons of different anxiety disorders. I have the DSM-5, which is the basically our Bible in the mental health profession of illnesses, and diagnostic criteria. Anxiety disorders are not the same. So someone with a panic disorder is not the same as someone with generalized anxiety disorder or a specific phobia. There are talk therapies to help, but if somebody has panic disorder, basically from a biological perspective, their fight or flight mechanism, to keep it simple, how our body responds in a state of emergency, is activated a lot to a much less intense stimuli than it would be to somebody normally. So, for example, if the average person was on an airplane that the pilot came on the loudspeaker and said, "We're going to crash," it's perfectly normal to be extremely anxious, heart palpitation, feeling like you're going to have a heart attack, difficulty breathing, etc. And you can't really help it. I mean, you can attempt to do deep breathing exercises, etc. But honestly, I mean, really, are you gonna, in that situation, are you gonna be able to? If your body's responding like that in a public speaking situation in the middle of a stage, are you going to be able to stop and do deep breathing exercises? I think not. People with an anxiety disorder, this fight or flight mechanism, this sympathetic nervous system, is activated a lot quicker and to a lot less serious of a stimuli. So something like public speaking, like I said, could cause the same level of anxiety as somebody who's, in a crashing airplane, or on a I don't know. You can think of a million situations where anxiety is justifiable. So, bottom line, start with something like a hydroxyzine. Now, something else, propranolol. Propranolol is a beta blocker. So it is basically a blood pressure medication. It has been used kind of off-label by musicians for quite some time to reduce stage fright. Then it's sort of common for surgeons right before an operation to take a propranolol, because it stabilizes the hand, makes it a little bit less jittery. The Olympic sporting whatever agency or department oversees the drugs and supplements that athletes are allowed to take, they've recently banned it because shooters, like let's say rifle competition shooters were taking it to keep their hands and aim steady. But propranolol used not every day. You do not want to use it every day, but used if, let's say, you have a public speaking arrangement and you're preparing for anxiety, especially if you sweat. It's a great tool. It lowers your blood pressure, calms you down. So something that a benzodiazepine would do. Now getting to you might be thinking, so you're saying all of these things that mimic what benzodiazepines do. So why don't I just take a benzodiazepine? Well, benzodiazepines do have a drawback, and it's worse with some than it is others. The ones with the shorter half-lives are the worst. So the Xanax, but the withdrawal from taking it prolonged, you can research benzodiazepine withdrawal symptoms. One of the most difficult things to get off of. It's not. It shouldn't be a go-to. I'll put it that way. And tolerance develops, it doesn't have the same effect. If, let's say, you're someone who gets a little bit anxious before they public speak, a little bit anxious in social situations, and you take, your general practitioner gives you Xanax for that, and you're basically taking, say, 1 milligram a day or 2, or anyway. And then all of a sudden you have a panic attack and you're rushed to the hospital. Well, they're going to give you Xanax, and guess what? It's not going to work. It's like with the opiates. A lot of people don't take pain medicine until they absolutely need it, so that when they do need it, it works. So that's kind of like a brief overview of my opinion of benzodiazepines. Some alternatives that I believe you should try first. But also, I want to make it very clear that I think that benzodiazepines are demonized because they're such a pop culture thing, just like Valium was back in the day, Xanax is now. And if general care practitioners stopped and gave psych referrals when they believe that patients might be indicated for benzodiazepine use, and they refer to a prescribing psychologist slash psychiatrist, it would be a lot better. And so anyway, post your opinions. There's tons of anti-benzodiazepine videos all over YouTube, people talking about terrible withdrawal effects. One of a very highly regarded psychiatrist, I was having a conversation with her the other day, and she said to me, when I have a patient who I've tried other things with and think that benzodiazepines might be an option, I tell them that the drug has a potential for tolerance to develop, dependence to develop, etc. But at the same time, I tell them I take a cholesterol pill every day, and I'm dependent on it. I need that. So it's like, just because you're dependent on something, like, wouldn't you rather be dependent on something, and something legal, something that you're, in most countries, something that's a prescription, and something that gives you a good quality of life. Just some things to consider, if you have any specific questions, if you want to give me a list of your symptoms, like I said, I'm not a psychiatrist, but I do have a strong interest in psychopharmacology and neurology. I'm a psychologist in training, so by no means take my advice over your psychiatrists, but it might just be some food for thought in your next your next meeting, and hope this helps. So have a great day, and I hope to talk to you all again soon. Thanks. Brand name wise, I'll just stick there for right now. Xanax, Valium, Librium, Ativan, things like that. And most of the videos, if you look on YouTube, you just type in Xanax. Most of the videos are going to be withdrawal stories, kind of like really horror stories. But if upon first glance, if you look at them, you're going to say that this is a terrible, terrible drug. It should be pulled off the market. And the same thing basically happened to Valium. It was the most commonly prescribed drug at one time in the U.S. in circa the 1970s. In psychiatry departments, drug trials, neurological studies. So anyway, I'm not claiming to be an expert, but I have a basic knowledge that I think I can speak on the topic. So Xanax, in pop culture, songs about Xanax bars, the common form of the 2 milligram dose. The movie Sex and the City, and sort of different pop culture icons talk about Xanax today, how people did about Valium in the 70s, 80s. It's not uncommon for someone to go to their general. Hey YouTube fans, this is BGA. I wanted to talk to you about something that's been on my mind today, and I've been watching a lot of videos on the subject, particularly videos by Dr. Mark Viner, who has been a huge inspiration for me in my career. He's a great psychiatrist based out of Arizona, deals with a wide variety of patients, and 99.9% of things him and I see eye to eye on. And yeah, I guess we're both a little eccentric in our own ways. But the one thing that I just watched a video of his on some of the benzodiazepines, and I really feel like this family of drugs have been demonized. Now, I am not a psychiatrist. I am not an MD. I'm a psychologist. I'm not a psychiatrist, not an MD. I'm a psychologist in training. However, I do plan on getting my master's in psychopharmacology. I have so that hopefully I'll be able to prescribe as well as do therapy, where psychiatrists can only prescribe and not do talk therapies. They used to, but insurance companies have pretty much killed that. So that's just a little bit about the information I know. I've done research in neurology departments, or practitioner, and get a prescription for Xanax for when they fly, or a prescription for Ambien, which is a benzodiazepine-like drug. What you really have to know is that these drugs aren't nearly as dangerous and as evil as many people would lead you to believe, if they are used properly and if they are used in the manner in which they're designed. Xanax, so this family of drugs is called benzodiazepines. So they all function to basically increase